Okay, now we have John Gerlich, who is the Nevada State Health Insurance Assistant Program. We're also called SHIP. Okay, it's all yours.
Good morning, everyone. I assume from looking around the audience, almost all of you are already on Medicare. SHIP was set up by the federal government in all of the states to assist Medicare recipients on making decisions about what is the best way to use or to get their Medicare and use their Medicare. I know all of you, when you signed up for Medicare, confusion, probably a lot of confusion, like myself when I turned 65. I'm a computer person by trade, and I spent 3 full business days figuring out what was the best way to get my Medicare. That's when I decided to volunteer as a counselor with SHIP. SHIP is a nonprofit. It is funded by the federal government through the state. The bulk of the people that perform the services that SHIP does are volunteers like myself. There is an office staff, a full-time staff, but the bulk of the work is done by counselors. We counsel people by them calling the main number, either the 800 number or the office number here in Las Vegas, and either requesting to have a face-to-face counseling session in the office, or most of our counseling is done by calling people back over the phone. We assist people in their initial choices for Medicare, whether to use traditional Medicare where they get Part A and they pay for Part B out of their Social Security check or as a bill from the government, and then they get a drug plan, a Part B drug plan, and maybe get a Medigap policy which covers what Medicare doesn't cover. A lot of people, until they have to use Medicare, don't realize Medicare only covers 80% of your medical bills. You are responsible for the additional 20%. The other option for people is Advantage plans, also called Part C. There's all the government letters and stuff involved with this, but Advantage plans, a lot of people use them because they cover everything. The doctor, the hospitals, outpatient facilities, drugs, all covered within that. And in most cases, there is no additional monthly premium other than the $104.90 that the government takes for your Part B premium. There are pluses and minuses to Advantage plans. For some people, they're the best option possible. For others, not a good option. It is very difficult. I'm not going to be able to tell you much about Medicare and what's best for you here today. So I'm going to suggest that when you get questions, there are brochures that look like this on the back table. On the back of them is the phone number for SHIP. Just make the call. And we're there to help you, with all of this. The other thing you need to be aware of, we will not say to you that you should do this, period. What we will do is give you the options. Obviously, we do not get any commissions from any insurance companies or anything like that, and we are totally independent. I know you all get inundated, during open enrollment every year by mail coming in, phone calls coming to you, everything else. We're there to try to help filter all of that to where it makes the most sense for what your needs are. My only thing I want to make sure everybody understands, every year, I don't care whether you have an Advantage plan or traditional Medicare, you need to review your plan. In particular, you need to review your drugs. Every year, whether the Advantage plan the drug portion of the Advantage plan or a Part D drug plan, the insurance companies change the formulary every year. You might be paying, a very low copay one year, and then all of a sudden, surprise, next year, it's going to be $50 more. It means they took one of your medications and moved it to a different tier within the formulary. Please, whether you do it yourself up online on Medicare.gov or you call SHIP, the first time you do either of those, have all your medications that you take on a regular basis, how often you take them, what your dosage is, what the strength is of the medication. We will put them into the Medicare.gov system, or you can do it yourself online, and then hit the Find Plan button, and it will come back with the lowest cost, annual cost, from each of the insurance companies, presented to you in lowest cost order, annual cost, which includes premiums, co-pays based on the medications and the frequency that you need to get them, and any deductibles. So every year, make sure you review, your Medicare, what's best for you. And call SHIP. That's all I have to say. Thank you.
Great, thank you.